Nursing Care of Eating Disorders. Module 4, Binge Eating Disorder and Emotional Drivers. Binge eating disorder is one of the most misunderstood eating disorders. This is not about lack of control, this is about function. For many patients, the binge serves a purpose, relief, numbing, or escape. When patients don't have effective ways to regulate emotions, food becomes the coping strategy. The binge is followed by shame, and that shame drives the next binge. This creates a repeating binge-shame cycle. Unlike bulimia nervosa, binge eating disorder does not involve regular purging behaviors. Binge eating disorder involves recurrent episodes of eating large amounts of food with a sense of loss of control. These episodes occur at least once a week for 3 months and are not followed by compensatory behaviors like purging. You are assessing for patterns, not just weight. Look for eating rapidly, eating when not physically hungry, eating alone due to embarrassment, and feeling guilt or disgust after eating. You need to ask directly, how do you feel before and after a binge, and how do you feel later? Binge eating disorder carries significant medical risk, including type 2 diabetes, hypertension, and cardiovascular disease. The priority is not weight loss. The priority is stabilizing eating patterns and behavior. You are helping the patient identify triggers. For example, stress after work leading to nighttime binge eating. This allows you to connect the emotion to the behavior. Regular structured eating reduces binge risk. Encourage consistent meals throughout the day to prevent extreme hunger and loss of control. Cognitive behavioral therapy targets distorted thinking patterns. For example, I already messed up, so it doesn't matter, becomes a pattern that needs to be challenged and reframed. DBT, also known as dialectical behavioral therapy, focuses on distress tolerance and emotion regulation. Patients learn how to tolerate discomfort without turning to food. Lisdexamfetamine, or Vyvanse, is the only FDA-approved medication for moderate to severe binge eating disorder. This medication is taken in the morning to avoid insomnia. You must monitor heart rate, blood pressure, and assess for potential misuse or dependence. If you lead with judgment, you reinforce the disorder. Your role is to create a safe, non-judgmental environment where patients can explore their behavior. To treat binge eating disorder, you have to understand what the behavior is doing for the patient, and then help them build healthier ways to cope. We've talked about what drives eating behaviors, the emotions, the patterns, the cycles, but insight alone does not create change. Patients can understand exactly what they're doing and still feel stuck because behavior doesn't change with information. It changes with skill, support, and direction.